Dermatological conditions, other areas, and other conditions. So, what else could things be? We've talked about bacterial and viral and fungal infections. So, what else could it be? Interrigo is a condition that may occur between the creases of the neck in the axillary and buttock region and beneath larger breasts, but it is primarily seen in the groin region in individuals with muscular thighs or in obese individuals. In severe cases, the skin becomes eroded and starts to weep. This can be prevented by wearing loose, soft, cotton underwear to keep the skin dry and clean and friction-free, or by wearing shorts with longer legs made of low-friction fabric. Wearing sports bras can also help in the aid of the treatment if this occurs under breasts. The treatment involves the initial application of a cold compress, cleaning with the daily mild soap and water, followed by an application of a soothing ointment. Athlete's nodules. These are asymptomatic dermal nodules. They're found at the sites of repeated minor stress, for example, on the feet of surfers or runners, the knees of canoeists, and the knuckles of boxers. Protective padding can help decrease the pain. These can be asymptomatic, meaning they don't produce symptoms. Usually, areas are well circumscribed, meaning they have definitive edges that are smooth, firm, and their skin colored papules and plaques over the dorsal aspect of the foot or the hands. Acne Mechanica. This presents with papules and pustules in areas of mechanical trauma. This is also known sometimes as football acne. The causative factor is most commonly chin straps, forehead bands, shirt collars, football shoulder pads, backpack straps, automobile seats, bras, wide belts, and orthopedic casts and braces. The signs and symptoms: if left untreated, the acne may develop into a cyst. The treatment and prevention includes a thorough cleansing of the area after a workout, with a mild abrasive cleanser and a back brush and applying a topical astringent. In severe cases, a systemic antibiotic may be prescribed. The condition usually improves or resolves after the season. Additionally, regular cleaning of equipment can help decrease the incidence of acne mechanica. Striae distanciae. This is often seen in individuals who participate in high-intensity weight training. This is sometimes known as stretch marks. The origins of these marks are unclear, but it's most often seen after rapid growth of a body part. We sometimes see these after pregnancy or after an individual has gained body mass very quickly. This is believed to result in fragmented elastic skin fibers. We most commonly see linear pink or flesh-colored patches. This is seen commonly on the chest, shoulders, and upper outer arms. At this point, there's no treatment available for striae distanciae. A sunburn. The prevention is wearing effective sunscreen or clothing that can help to prevent sunburn in the first place. The damage depends on the length of exposure, level of sun intensity, and the personal skin type. The effectiveness of sunscreen is based on the sun protection factor, the SPF. The SPF of 15 indicates that an individual can be exposed to ultraviolet light 15 times longer than without a sunscreen before the sun will begin to burn. Higher numbers provide better protection. The signs and symptoms may depend on the degree of the burn. A first degree may result in mild erythema. Second degree burns, we will see vesicles or blisters in addition to the erythema. In third degree burns, we will see skin ulcerations, systemic fever, chills, nausea, and even exhaustion. The full extent of the injury may not be assessed until 24 to 48 hours after sun exposure. Although sunburns are easily treated, it's best to prevent them from occurring in the first place. The management is cold compress, hydrocortisone, and aloe. For moderate to severe burns, a physician referral is warranted. Malaria rubra. This is also known as prickly heat. This is caused by active sweat glands when they become blocked by organic debris. This can lead to an inflamed and porotic skin eruption. The treatment is cooling and drying of the skin, controlling the itching, and watching for potential infection. Eczema. This may be an acute or chronic inflammatory condition of the skin. Eczema can have an onset in the first 2 years of life, and a history of asthma or hay fever may be reported. Eczema can take a physical and an emotional toll on an individual. Signs and symptoms include poorly marginated erythema and scaling with exudate. Persistent itching and burning can lead to excoriation of the skin. The condition is often aggravated by an increase in body heat and perspiration. We can manage eczema with topical corticosteroids and an emollient cream or an ointment base to serve as a substitute for soap, bath oils, and moisturizers. Consistent use of the steroid cream is essential for it to be effective. Psoriasis is a chronic distressing skin disorder. It can affect the skin, tendons, ligaments, and the joints. Factors that may trigger psoriasis include a systemic infection, such as strep throat, an immune system response to disease, injury to the skin, and certain medications, alcohol, and environmental factors such as overexposure to the sun or prolonged contact with chemicals such as disinfectants and paint thinners. Topical therapies are effective for mild to moderate cases where phototherapy and systemic medications are more appropriate for more severe cases. Psoriasis is a chronic skin condition that is characterized by a rapid buildup of rough, dry, dead skin cells forming thick scales. We have different types of psoriasis, including plaque psoriasis, goutte psoriasis, erythrodermatic psoriasis, and pustular psoriasis. The treatment categories depend upon the type of psoriasis. Topical modalities, phototherapy, and systemic therapy are all available. Non-melanoma skin cancers. This is the most common cancer in humans worldwide. It's classified into two categories depending on which type of cell is affected: basal cell carcinoma and squamous cell carcinoma. Both arise from keratinocytes, and they rarely spread to other places in the body. Due to the rising incidence of this largely preventable form of cancer, the NCAA has issued a sports medicine guideline in 2012 that addressed the safety and prevention of skin cancers. Melanoma, skin cancers arising from melanocytes found in the striatum basilae, eye, inner ear, meninges, heart, and bone. This is the most common types of superficial spreading melanoma and nodular melanoma. Susceptible individuals typically are fair-skinned, blue eyes, and they sunburn easily. Individuals will typically have multiple sunburns at an early age, and a family history of skin cancer is likely. The rising incidence and overall mortality rate of melanoma is high. This kills more young adults than any other type of cancer. It is important to understand the ABCDEs of melanoma. A is the asymmetry, B border, C color, D diameter, and E evolving. Hyperhidrosis. Hyperhidrosis is considered excessive perspiration. There are multiple influencing factors, but signs and symptoms include excessive perspiration that's triggered by emotion. A number of factors can affect how much an individual sweats and even how the sweat smells. Some people sweat more than others for no apparent reason. However, other factors can cause intense sweating. These may include hereditary, certain foods such as spicy foods, hot beverages, or beverages containing caffeine or alcohol, and certain drugs, such as antipsychotic medications, morphine, or excess doses of the thyroid hormone thyroxine, and overdoses on analgesics such as aspirin and acetaminophen. This condition can interfere with sports that require holding various objects, such as balls, discuses, bars, oars, or even sticks, or require gripping, such as a tennis racket or racquetball racket. Different regions can be affected, such as the face, underarms, palms, and even the soles of the feet. Palmar hydrosis usually is accompanied by plantar hyperhidrosis. Bromhidrosis is an infection in skin maceration. This can be difficult to grasp common objects, and many individuals will avoid handshakes or choose not to touch other individuals because of the sweatiness of their palms or feet. The management is often antiperspirants. Although newer treatments include the use of Botox injections as well as surgical interventions. Frostbite. This is caused by the vasoconstriction in response to cold, resulting in freezing body tissues. This occurs commonly on exposed skin, especially the ears, nose, cheeks, and wrists in very cold environments. The intrinsic risk factors include fatigue, circulatory impairment, malnutrition, and a prior history of cold injury. Extrinsic and environmental risk factors include wind chill factors, inadequate or constrictive clothing, high altitude, and prolonged cold exposure.